Imagine a 45-year-old woman arriving for her yearly checkup. She leads a busy life, juggling work and family. Health is important to her, but she confesses to sometimes delaying appointments. Today, she's here for a routine visit. Little does she know, this appointment might be anything but routine. It's time to discuss cervical cancer screening. Cervical cancer, once a leading cause of cancer deaths in women, is now highly preventable. Early detection is key. This is where regular screenings come in. Our patient, like many women, might not be fully aware of the latest guidelines. This presents a valuable opportunity to discuss the importance of cervical cancer screening and how it's changed over the years. This scenario is more common than one might think. Many women are unaware of the latest recommendations or unsure if they need to be screened at all. This highlights the critical need for clear and accessible information about cervical cancer screening. This is not just about following medical advice, it's about empowering women to take control of their health. Cervical cancer screening guidelines have evolved. For women aged 21 to 29, a PSA smear every 3 years is recommended. This test examines cells from the cervix to identify any abnormalities. For women between 30 and 65, there are 2 options: a pap smear every 3 years or a combined pap smear and HPV test every 5 years. The HPV test looks for the presence of high-risk strains of the human papillomavirus, a common sexually transmitted infection that can lead to cervical cancer. The combined approach offers a more comprehensive screening method. For women over 65 who have had regular screenings with normal results, screening may no longer be necessary. These guidelines are designed to maximize early detection while minimizing unnecessary tests. However, individual risk factors may necessitate a different approach. Factors like a history of precancerous cells or a weakened immune system might warrant more frequent screenings. It's essential to discuss individual health history and concerns with a healthcare provider. The human papillomavirus, or HPV, plays a significant role in cervical cancer. Most sexually active individuals will contract HPV at some point in their lives. While most HPV infections clear up on their own, some high-risk strains can persist and lead to cellular changes in the cervix, potentially developing into cancer. Thankfully, there's a powerful tool against HPV vaccination. The HPV vaccine is incredibly effective in preventing infection from the most common cancer-causing HPV strains. It is recommended for both girls and boys, ideally between the ages of 11 and 12, but can be given up to age 26 if not received earlier. The HPV vaccine is a game changer in the fight against cervical cancer. While it doesn't protect against all HPV strains, it significantly reduces the risk of developing cervical cancer and other HPV-related cancers. It's important to note that even vaccinated individuals should still adhere to recommended screening guidelines, as no vaccine offers 100% protection. Following a cervical cancer screening, receiving the results can be a nerve-wracking experience. What happens if the results are abnormal? Firstly, it's crucial to remember that an abnormal result doesn't automatically mean cancer. It simply means further investigation is needed. Abnormal results are categorized based on the severity of cell changes observed. For minor changes, a repeat pap smear or HPV test might be recommended after a certain period. More significant abnormalities might necessitate a colposcopy. This procedure allows a doctor to visualize the cervix with a magnifying instrument and take a biopsy if needed. The management of abnormal results varies depending on the specific findings and individual patient factors. The key is open communication with a healthcare provider. They can explain the results in detail, discuss the implications, and outline the appropriate next steps. Early detection and timely management are crucial in preventing cervical cancer and ensuring the best possible outcomes.